Good morning. This is Dr. Thomas Bartell, board certified plastic surgeon, specializing in body recontouring surgery here in the Madison area. And once again, I am co-opting my wife's office. She is a clinical psychologist. She actually has a much nicer office and much more spacious than mine. And today I thought we could talk a little bit about abdominoplasty, sometimes called tummy tucks, correcting a mommy tummy. This is a very common procedure that I perform. It's actually the second most common procedure I perform. What I'd first like to talk about is who's a good candidate? Who are the types of patients that I see for this problem? Typically these are women in their 20s and 30s who have had a few children or one or two, several children, and want to repair the damage that the pregnancy has done on their abdomen. Problems that include a little excess fatty tissue, but mostly it's excess laxity, looseness of the foundation under the skin and fat layer. Under there are two muscles called the rectus muscles. They're about as wide as your hand, and they originally, when the patients before pregnancy, they were pretty much right up against each other. But as pregnancy progresses, the muscles tend to slide apart to allow the uterus to expand. And what happens is then there's fascia, which is a strong connective tissue that's in between, still holds your insides in. But once a delivery has happened, the muscles don't always go back to where they were. There are no springs attached here. So now this sheet of foundation that's made out of the muscles and the fascia has a larger surface area, so it billows out like a sail. And that causes most women who have had a pregnancy to have a bit of a pouch down here. Now what they do is they tend to want to go to the gym and do their crunches and their sit-ups and so forth to try to tighten that up. But that's not going to work. It's going to strengthen the muscle, but it's not going to force them back together. So they're always going to have that little pouch. In addition, many will also have excess skin. That's because the skin got stretched out. The other type of patient that I see for this problem are the ones that have had some type of bariatric surgery, stomach stapling, anything that causes a significant amount of weight loss. And those tend to have a lot of excess skin. So, who's a bad candidate for a tummy tuck? Well, first of all, someone who doesn't really need one. Some patients will come to me and they might have had a pregnancy, they might have not, but they just have a little extra fatty tissue on their abdomen. And those ones, all they need is a little liposuctioning. So that's what I would recommend. It's not very common if you've had a pregnancy that liposuction alone will take care of your problem, but the only way to know for sure is to come see me and I'll let you know. Patients who are not, who aren't sure that they're not going to have any future children. Future pregnancies are going to undo all of my good work. Now, that doesn't happen very often, but it has happened once or twice, and I don't want to have to spend all the effort in giving you a nice abdomen if you're only going to go out and ruin it again by another pregnancy. Patients, obviously, who are not medically stable. They have uncontrolled diabetes, or they have heart disease, or any of these other things. Patients who are still smoking. I won't operate on you. The reason, it's not purely punitive, obviously, but smoking adversely affects the scar formation, and I want this scar to form as imperceptibly as possible, and smoking directly adversely affects that. Patients who are still moderately obese, overweight, it's just not safe to do a outpatient surgical procedure on a patient with a very high body mass index. And we have a relative cutoff of 32 for a BMI. This is calculated based on your height and your weight, and there are multiple BMI calculators on the internet, so if you want to calculate your own, you just go on there and you type in what your height is, what your weight is, and it spits it out. If it's above 34 or 35, I'm happy to talk to you about any surgical procedure, but we're not going to do the surgery. It can still be done in a hospital setting. It's just not safe to do it in an outpatient setting, and I'm a safety guy. So you might want to consider that. Anyway, the procedure itself is done here in my own operating room. We're a fully accredited surgery center. Typically, a patient will come in, I will put some marks on them, and where I'm going to be starting off by doing some suctioning. I like to do some liposuctioning on my tummy tuck patients to start off with, and that typically is on the upper abdomen and then on the waist area, kind of off onto the flanks and the hips, because that gives me a nicer contour when I'm finished. All right, once I'm done with that, then we do the actual surgery part, which involves making an incision that's very low down. It's usually below, almost always below a C-section scar if you have one of those, but typically below the hairline. Now it does flare up a little bit on the sides because that's what swimsuits do, and I want to keep this under a two-piece bathing suit if at all possible. Now that's not an incision that goes deep inside you though, like a C-section or gallbladder procedure or appendix operation. It just goes down to the foundation. And then I lift everything up so I can actually look at the foundation. Then I repair the foundation. I get that nice and tight by sewing the muscles back together where they were before. And then we actually bend the table a little bit, and I pull down on this thing that I lifted up, and I trim off what I don't need, which is usually a piece of you about that big, and then I put everything back. It's your belly button, goes right back where it was before, but the skin around it has moved down. And I put in my stitches down below. I usually put a little drainage tube in. I make a nicer shaped belly button than the one you had before. And then we wrap you up in a corset. After 45 minutes to an hour in the recovery room, off you go. Surgery itself takes about 2.5 hours. Of course, we send you home with pain medicine and so forth. Most folks who at, say, desk jobs are back to work within, maybe a week, certainly within a week, but no heavy lifting. Nothing heavier than your shoes or your purse for 3 weeks. Now that's important to keep in mind for women who have 18-month-old or 2-year-old children at home. You can hold an 18-month-old or pick up or let them crawl into your lap and stand up, but I just don't want them to reach out and pick up something heavy because I don't want them stressing the muscles of their abdomen. Most folks are back doing everything they were doing before in 2 to 3 weeks. The main drawback with, of course, a tummy tuck is the scar. Now, scars take up to 2 years to completely fade. Now, when I say completely fade, I don't mean completely disappear. I mean fade as much as they're going to fade. But again, I put the scar in a place that theoretically only your closest friends are ever going to see. And I make it as low as possible and as short as possible. But scars differ in every patient depending on your anatomy. So no two scars are ever going to be the same, and no two people scar exactly the same. Some people scar very well, some people not so much. We do everything we can to give you the best scar possible, but obviously we can't make any specific guarantees in that regard. But if you wanted to see some typical scars of my patients, come for a consult, and I've got books and photos, lots and lots of befores and afters that you can see, and you can kind of get an idea of what that's all about. So anyway, that's how I do this. One more issue, of course, is who is the best one to do your tummy tuck? Well, obviously, it should be a board-certified plastic surgeon. Obviously, it should be done in an appropriate facility. We are an accredited facility. We are very private. Some of the other doctors that operate in these larger surgery centers that are multi-specialty, and the privacy is not quite as secure as it is here. But what people don't understand is you don't need to have an accredited facility to do any of this type of surgery. All you need is a license to practice medicine and an MD degree. You could be doing. It's legal to do this kind of work in your garage. Why you do that, I don't know, but there are been history of people who go down to other countries and they're having their cosmetic procedure done in a hotel room by Lord knows who, and of course those typically never turn out well. You want to go to a surgeon who has a lot of experience doing this kind of work. I have almost 30 years of doing these type of operations. You want to go to a surgeon who does a lot of them, and that drifts back to the issue of whether you're going to a full-timer or a part-timer with regard to cosmetic body recontouring. Someone who does all types of plastic surgical procedures, reconstructive and so forth, and someone who just specializes only in this type of work like I do. You want to know who's holding the knife ultimately. I practice by myself. I'm the only, if you're coming to, for a surgery by me, I'm the one who does the surgery. There are other practices who don't operate quite that way. They have associates, residents, other people who are in the operating room who perform part of the operation, possibly even all of the operation, under the supervision of the supervising surgeon, but he's not necessarily the one holding the knife. So you might want to ask who's actually going to be doing the operation. And finally, you want to know who's going to be taking care of you after surgery. Who do you call if you're having a question or a problem? Most practices have a call system set up where you call the general number and it's routed through a call center to whoever the person on call is. It might be a nurse, it might be a covering physician, but it's not necessarily the surgeon who did your surgery. I've been taking my own calls all my life. That's what I do. If you have your surgery done by me, you want me to answer your questions. If you call someone else, they don't know you, they don't know what you had done, they don't know what you're trying to accomplish. They might be able to refill your pain medicine prescription, or maybe not. But it's a much better, I think, continuity of coverage if the person that's taking care of you post-operatively is the one who operated on you. It just makes sense to me. So that's why I only take my own calls. I don't farm that out to anyone else. Well, I think that's it for today. I'm unfortunately not going to be here next week. I'm taking a short vacation, well-deserved, because we're real busy this time of year. But I will be back the following week, and we'll talk about something interesting as well. So try to stay warm. I'll see you then.